Post-traumatic stress disorder is a stress-related psychiatric condition that can occur and persist following traumatic events. It can come as a result of any intense emotional trauma, such as natural disasters, military combat, or violent road accidents. It can have a wide range of symptoms, including re-experiencing trauma, self-isolation, emotional numbing, and peripheral conditions such as depression, anxiety, and substance abuse disorder. The biological characteristics of PTSD include large autonomic responses, such as heart rate and respiratory rate, to traumatic stimuli, such as loud or upsetting noises. PTSD sufferers often also have a reduced volume of the hippocampus, which is responsible for some aspects of memory. This is visible on this MRI scan. Increased expression of muscarinic glutamate receptor 5 is also common in PTSD patients. This receptor is implicated in the perception of fear, as well as the stress response. This altered expression is visible on this PET scan as the red areas around the brain. Currently, the only FDA-approved medications for PTSD are the SSRI antidepressants sertraline and paroxetine, but the anxiolytic drugs diazepam and alprazolam are also commonly used. These medications only target the symptoms of PTSD as opposed to its root cause, so the drug is taken daily, but the condition is rarely actually cured. These drugs can carry the risk of severe side effects as well as the patient developing a dependence on them. MDMA-assisted psychotherapy typically involves the oral administration of 50 to 120 milligrams of pure MDMA during 3 or 4 monthly psychotherapy sessions. These sessions are held in conjunction with weekly non-assisted therapy sessions. You can see an example of a regimen here. In this format, MDMA is only taken in the presence of a trained clinician, removing the potential for abuse. MDMA can be beneficial for PTSD as it allows the patient to openly reflect on their trauma from a new perspective and with less stress. This allows the clinician to efficiently address the source of the condition. This potential has been recognized, and in 2017, the FDA granted MDMA breakthrough therapy designation for PTSD to expedite its research. Here we can see a summary of the results from Phase 2 of MDMA's clinical trials. These results come from a study including 28 patients consisting of war veterans, police officers, and firefighters who had been experiencing severe PTSD symptoms for an average of 30 years. As you can see in the diagram on the left, after 12 months, 76% of MDMA-treated subjects no longer met the clinical criteria for PTSD, in contrast to the 18% of subjects who were successfully treated with psychotherapy alone. The graph on the right shows that even after just 2 months of treatment, the MDMA-treated subjects saw an average reduction in CAPS score of more than 50%. This drop signifies the subjects going from severe or extreme PTSD to mild PTSD. This treatment strategy entered Phase 3 of clinical trials in September of 2018, and full FDA approval is expected in 2021.